agitated depression, and in various other neurodevelopmental abnormalities as well. So prefrontal cortex is one of the areas of brain which has the maximal expression of this protein kinase C. The very basic, what we all know and how we actually teach is that we have our prefrontal cortex, that is the seat where we have a brake or a control. This control has evolved nearly 50,000 times from primates to humans. And particularly the orbitofrontal cortex, the medial dorsolateral prefrontal cortex, it regulates our behavior, thought, and overrides our impulsive urges. That is where is the seat of executive functions. When you actually go for a go-no-go test or you do a Luria's test, you are testing whether a person has the ability to control these overriding impulses. And that is where the prefrontal brakes are pushed. This is a top-down guidance model of attention. And if you look at the protein kinase C, it involves not only attention, but also the impulse control, which is so important in guiding our behaviors. This is one of the papers which looked at how impulsivity plays in borderline personality and ADHD. The scan could not be enlarged, or else I would have showed that how the different areas, especially orbitofrontal, dorsolateral medial prefrontal cortex, the precuneus, and the insula, the areas which are responsible for differentiation of self-identity and that of others, how they are involved in guiding our impulses. One of the prime areas, particularly in rodents, in animal models, where this has been studied, is substance addiction. We know that there is a difference in impulse control disorders and compulsive disorders. Typically, hair pulling or trichotillomania or skin picking falls under the impulse control domains, even though in DSM they come under OCD related spectrum. But even substance abuse can be considered under the impulse discontrol domain. Whereas, typical example of OCD is where compulsive behavior follows. There is a debate where pathological gambling, sex addiction or sexual addiction, pornography addiction, if at all these entities can be classified, that's a debate in itself, how that is related to the amygdala function and the control on basic urges and impulses. Now, long story short, impulsivity is what we call as the externalizing liability, risk-taking, novelty-seeking, the typical cluster B type of personality, and which corroborates with type A2 type of personality in earlier classifications, which can lead to ADHD symptoms, oppositionality, conduct, substance use, and antisocial behavior. If you look at the research domain criteria, commonly known as RDoC, RDoC doesn't talk in terms of disorders. It conceptualizes psychiatric disorders as neurobiological traits. So if you look at RDoC, impulse discontrol is a separate domain under which all these disorders are classified together. Protein kinase C in prefrontal cortex is also involved in working memory. Why is this slide important? Because working memory is one of the cognitive functions which is related to how we deal with our impulses. If I have controlled an impulse, that memory stays. If I have indulged into an impulse, that memory also stays. Next time, when a similar situation happens, that memory plays a very important role in deciding how I'm going to behave in that particular situation. There has been increasing role of PKC. There was one of the first inhibitors which today is not currently in practice. It was first developed to see if it can reverse opioid withdrawal. One of the things which was seen in rodent models again, that if you activate the protein kinase receptors excessively, memory declines rapidly. Again, working memory, short-term memory. This is a very brief of how PKC signaling happens. We'll not delve too much into theory, but without putting this slide, the practical implications do not have a context. I know this again looks like your Stephen Stell cartoon, but then this is a very basic understanding of short term, there is neurotransmitter regulation. Long term, there is cell proliferation, synaptic remodeling, and neuroplasticity in three most important areas of the brain: orbitofrontal cortex, the entorhinal cortex part of hippocampus, which is again related to memory, and the amygdala, which is the seat of human emotions and emotional processing. There are a lot of PKC subvariations as well, alpha, beta, gamma. Let's not go into the theory here, but of course, there are implications related to how it all affects memory and impulsivity. One of the biomarkers that has been tried, there was a fantastic thesis, it's still not published in NIMANS by one of my juniors, was platelet protein kinase C expression in bipolar disorders. And it was seen that in an individual, even before the episode starts, there is a raise in the level, which can be actually considered to be a potential marker if there is an impending mood episode. We know that there are imaging markers, but this is relatively one of the simpler biochemical markers that has been used. Well, coming to the impulsivity domains now. These are all the disorders which have been included in the RDoC domain related to impulsivity, and in which disorders a person has difficulty in controlling their impulses or has a reduced function of prefrontal cortex. I'll not go into too many trials and summaries. This phase 3 clinical trial led to the FDA approval of endoxifen. So just to put a summary, endoxifen was compared and was found to be not inferior to 1000 mg of divalproate sodium. It demonstrated improvement in subscales of YMRS, less EPS and metabolic changes. The commonest side effect was headache, insomnia, and restlessness within the first 2 weeks of therapy. Phase 4 trial, if you look at it, you will see that the YMRS reduction was much more rapid. Again, in an individual who is suffering from mania, you cannot afford the time for too much of delay. And safety profile as monotherapy was quite significant. We speak about the cost. Yes, it is a costly molecule, but you will often see the amount of medications a person is on. It's a long list. So there is a cost comparator efficacy trial as well. If you look at the accumulating cost of one after other molecule on a person which is not remitting bipolar versus relatively a couple of molecules of which endoxifen is one, you will see that the cost factor matters less. So can we look at endoxifen as a monotherapy? It has a good tolerability. It's a molecule which of course has a good control on impulsivity. Yes, it doesn't regulate sleep well. That's one of the drawbacks. On longer duration, studies have examined it for up to 1 year without any major metabolic side effects, which is the main issue with antipsychotics. And the use has exponentially increased with a period of time. This was one of the retrospective open study. This was published very recently. It's a real-world evidence of endoxifen. It's a 12-week open-label study. Of course, it is not as rigorous as a RCT, but then it's difficult to do an RCT compared to placebo in an illness like bipolar. And this was a study in which multiple Indian sites participated. Ranjana is aware of this. He has been a part of a similar trial in the past. And there have been ongoing studies, ongoing trials right now, of which I'm a part as well, which hopefully some data should be ready in the next couple of months. So this is a case report of bipolar where endoxifen was continued up to 1 year and multiple other medications have been stopped. And if you look at it, within a span of 3 weeks, the reduction in mood symptoms was significant with 8 mg once daily dose. Now remember, the FDA has approved 8 mg once daily dosing, but there have been clinicians who prescribe it up to 4 mg, start with 4 mg, some who have prescribed it up to 8 mg twice daily. I personally have prescribed it at 16 mg in round about 8 patients whom I have seen that 8 mg has caused a benefit, but yet I am not getting the complete clinical remission. But for all practical purposes, as per as the trials and the guidelines, 8 mg starting, 8 mg maintenance should be a good enough dose. We look at the quality of life, not just clinical remission. So this study, the case report as well, showed that yes,